Let's bring in Dr. William Schaffner. He's the chair of the Department of Preventive Medicine at the Vanderbilt University Medical Center. He joins us from Nashville, Tennessee. Dr. Schaffner, welcome.
Good to be with you, Asieh.
More than 2 billion people could be at risk of Zika in parts of Africa and Asia, including China, India, Pakistan, Indonesia. How did we get to 2 billion, and are you concerned?
Oh, yes, I think we're all concerned, we in public health and infectious diseases. This is a virus, of course, that is spread by mosquitoes and can be spread sexually. So there are two ways this virus can spread. There are large populations in, as you say, Asia and in India, where they have the hot, humid climate, they have the mosquito, and they have the interactions with the Western Hemisphere, where the virus is currently spreading rapidly. So this is a large, potential, dangerous outbreak.
Initially, when we learned about the Zika virus, the preliminary risk seemed to be to pregnant women. Should we be concerned, those of us who are not pregnant?
I don't think we have to be seriously concerned, because the greatest risk, as you say, is to the developing fetus in the pregnant woman. However, the more we learn about the Zika virus, the nastier this virus becomes. We're concerned that young children can also, if they're infected, have some neurologic damage. It's not yet well established, and there are some beginning investigations to suggest that maybe adults even can sustain some damage. And then there's the transiently paralytic disease, Guillain-Barré syndrome, which can follow Zika, and that can happen in adults. Fortunately, most of those people recover.
Dr. Schaffner, why is the Zika virus spreading so quickly in Singapore? Nearly 200 locally transmitted cases, including 2 pregnant women.
Well, Singapore, hot and humid, it has the mosquito vector, and there's a large concentration of people in a small area. And it's taking time to get all of the mosquito abatement activities underway to try and interrupt that local transmission.
Mosquitoes carrying the Zika virus have also been identified in a very popular destination here in the United States, Miami Beach area. Should people avoid going to Miami Beach?
Yeah, people are avoiding going to Miami Beach and South Florida, but this is particularly advisable for women who are pregnant or are thinking of becoming pregnant. This is not the time to go to Miami-Dade County, for example, unless you have a very urgent reason. And if you do, use that insect repellent. As I like to say, the fragrance of the season is DEET.
All right. And Dr. Schaffner, finally, how close are we really to a safe and effective vaccine against the Zika virus? Are we talking about months? Are we talking about years?
Well, many institutions, both public and private, are working to try to develop a Zika vaccine. The first 2 vaccines are being put into volunteers right now. It will still take a year or even 18 months, I'm afraid.
Dr. Schaffner, always a pleasure. Thank you so much.
My pleasure.